then I think in terms of law enforcement, in terms of selection of police officers, I would like to see them give police officers the Milan Clinical Multi-Axial Inventory.
Okay.
And if anybody has an elevated score on narcissism, they should be denied. They should not be allowed to be a police officer.
You're listening to the latest dose of Bipolar Recorder. This podcast may cause dizziness and blurred vision. Enjoy.
Welcome back to Bipolar Recorder. I am your host, Hunter Keegan, and today we have a very special installment for the series. I know that I say that a lot, but I am particularly hyped up about today's episode because it features our first expert guest. His name is Dr. David Wimer. Dr. Wimer holds a PhD and has worked as a psychologist for over 20 years. Currently, he teaches courses on abnormal psychology at Penn State University. As I've mentioned a few times on this show, I hold a bachelor's degree in psychology from Penn State, and Dr. Wimer was actually one of my professors while I was attending school there. In this installment, we talk a bit about our personal connection and the unique way that we met, but primarily, we focus on recognizing the importance of mental health when it comes to young adults, especially college students. We also talk about Dr. Wimer's personal, lived experiences with depression and trauma recovery. This episode is so cool. I cannot tell you how excited I am to share it with you, to have the opportunity to speak with someone who is not only an expert in the field of psychology, but who also taught at the university while I was attending there and taught a class that I was enrolled in was just absolutely incredible. I do have a quick content warning for you. At a couple of points in this installment, Dr. Wimer briefly references trauma that he himself experienced as a child growing up in an abusive household. He does not go into any sort of graphic detail, but this subject matter may be uncomfortable for some listeners, so I'm just pointing that out. As always, we want to make sure everyone's feeling safe on these streets. Let's dive in. Today, I am joined by our first expert guest, Dr. David Wimer. Dr. Wimer is a professor at Penn State University where he teaches advanced abnormal psychology and conducts scholarly research. He holds a PhD and is a licensed psychologist. He is also a veteran first lieutenant of the U.S. Army Medical Service Corps Reserves and even moonlights as a science fiction and fantasy author. I met Dr. Wimer in fall of 2014 while I was enrolled in one of his abnormal psych courses at Penn State, and we'll certainly talk a bit more about that later. But for now, Dr. Wimer, I just wanted to pass it over to you for a second and start with a very general question, which is, what exactly is abnormal psychology?
Well, I teach two versions of abnormal at Penn State. I teach Psych 470, which I believe you had with me, Advanced Abnormal, and I
That's
actually
correct.
created the World Campus version of Psych 270, Intro to Abnormal. So, but anyway, so chapter one of the course is all about that. What is abnormal, right? And there's many different perspectives and so forth. Is it statistically abnormal? Somebody with an IQ of 140 can technically be considered abnormal, because their IQ is statistically more than 2 standard deviations above the mean. So there's many things considered. I actually am not, even though I teach the class called abnormal, I'm not a huge fan of the word,
Sure.
If it was up to me, I would call the course psychopathology, advanced
Okay.
psychopathology and intro to psychopathology.
Hmm.
But basically, you can consider something or someone abnormal, I think, based on like the global assessment of functioning scale
Hmm.
for two things. If there's distress, right, an excessive amount of distress or life functioning issues, right?
Hmm.
If somebody has problems in life functioning, and in my classes, I talk about four different areas of life functioning. There's relationships, there's academic functioning, if applicable, career functioning, if applicable, and then just daily tasks like can the person groom themselves? Can they drive a car? Can they feed themselves? Things like that. So if somebody has problems with functioning in those areas, then I think somebody's issues can be considered abnormal.
Fantastic breakdown. Now, you mentioned something, I believe you said global functioning
Global
scale,
assessment of functioning, yeah. You
global
should remember
assessment.
that from Psych 470.
Ah! Oh man, 2014 was a
Mhm.
long time ago.
I know.
Global assessment of functioning scale. Could you explain a little bit more about that?
Yeah,
Could you refresh my memory from your class?
yeah, that's right. It's actually no longer in the DSM.
Hey, it's Hunter with a quick point of clarification for anyone who's not familiar with the DSM. The DSM is the Diagnostic and Statistical Manual of Mental Disorders, and it's used by psychologists and psychiatrists to diagnose and categorize different types of mental health conditions. There was previously the DSM 4, but in 2013, the American Psychiatric Association released an updated version called the DSM 5. All right, back to the show.
But it was in the
Okay.
DSM-4, but they took it out, but I still think it's important. So it's basically, it goes from 0 to 100, 0 being not enough information. Then there's 1 to 100, and it's just with higher being more functioning, right? So you could probably just go on PDF and find global assessment of functioning, but it's basically just a measure of how well somebody's functioning. And there's two things, like I said before. There's how well do you function in terms of those areas that I talked about before, and also how much distress do you experience, how much symptomology do you experience.
Mm,
The symptomology and functioning, and usually what I tell my students is go with whatever one is worse. So if somebody's
mm-hmm.
functioning okay, but they have really, really bad symptoms, let's say severe OCD, and to the point in which they can't leave their house, then their functioning score will be based on the OCD symptomology. But if somebody doesn't have any symptomology, but their life functioning is really, really bad, for example, they're homeless,
Mm.
then you would give the functioning based on that. Does that make sense?
Absolutely makes sense.
Yeah.
And thank you for that concise breakdown. I really appreciate it.
Okay, good.
So let me ask you on a just broad level, going back, what got you interested in psychology in the first place?
Yeah, that's a great question, Hunter. So a couple of different things. There's the academic side and then the personal side, right? I'm sure
Sure.
everybody who goes into psychology has a kind of a personal reason, and then there's the academic reason. So the academic reason is I at Council Rock High School. I'm from Newtown, Pennsylvania originally, and I went to a high school called Council Rock, which I'm very fortunate. It's one of the best high schools in Pennsylvania. I'm very fortunate to have gone there. And I had a teacher my senior year of high school named Mrs. Raberman, and I had her for psychology. So I took psychology in high school, and
Nice.
I ended up just really liking it. And my favorite thing, I remember my favorite thing about that class was when I learned about Carl Jung's theories.
Oh, yeah.
So that was something that really got me very interested. And I'd actually just taught about Carl Jung a week ago in my personality class.
Yeah.
So, and then when I started at Penn State Abington, it was called Penn State Ogontz at the time when I went there. This was the fall of 1994. So I started at Penn State Abington, and I did not want to be undecided. So I just picked psychology as a major kind of out of the blue.
Sure.
And here I am, many, many years later, still doing it. The personal side is basically just to be completely honest and open. It's I just had a very traumatic childhood. So growing up, my mother has borderline personality disorder, and
Okay.
my dad is a narcissist. So they had a pretty explosive relationship.
Hmm.
And there was pretty severe domestic abuse in my house. Maybe in the future, if you ever have me on again someday, I mean, I could talk more detail about that, about my traumatic childhood. But
Hmm.
basically, when I was a kid, I personally knew every local police officer because they were over my house so many times. And the
Yeah.
walls of my house looked like pieces of Swiss cheese from people smashing them in and stuff during fights. And so, I mean, I could go on and on and on. But anyway, so I have a lot of mental health problems from that. Also, mental health problems run in my family. And so, for example, my cousin, who's very open about things, has bipolar 1, my cousin Chris.
Oh, cool. Oh,
And
well, not cool, but
no, it's not, but I mean, yeah,
relevant
somebody
to
I
me.
care about quite a bit. And
Absolutely.
he's very open about his stuff. And anyway, so but I saw a psychologist when I was in high school, when I was or maybe even later toward junior high. And I don't know specifically what he diagnosed me with, but I'm pretty sure I struggled with depression in high school mostly.
Okay.
So I struggled with depression in high school, and he couldn't prescribe, but he sent me to a psychiatrist, and he put me on Prozac when I was in high school.
Okay.
And I'm actually on Prozac again ever since ever since COVID. But if it wasn't for Prozac, I'd probably be dead. I'd
Wow.
probably be dead nowadays because I was extremely depressed when I was a teenager. Had lots of suicidality and so forth. But it just going on Prozac and then getting away from my toxic family and going away to college. So my first year of college was horrible because I commuted. But
Mm.
I eventually went to Ithaca College, and getting away from my family was the best possible thing I could do. My immediate family. I love my aunts and uncles, cousins, but my parents are a train wreck, right? So they're a major reason why I have mental health problems and so forth. But anyway, so that's basically it. So I just chose psychology and as a college major, and I ended up being really, really good at it, and just it was perfect for me.
Wow. That's really interesting that you have that combined experience and knowledge base to draw from
Yeah,
as a professional, as what you're currently doing.
yeah.
Something that comes to mind for me when I hear individuals like yourself who are really experts in the field, what's it like working with a psychiatrist or therapist when you yourself are already
That's right.
very up to speed on everything? Do you second guess them at all ever? Does that happen?
When I was a kid, I had good experiences, but of course now I'm an adult. I have a PhD in psychology, and the last few therapists I've seen have been kind of terrible. And it's first of all, it's I made the mistake of using Penn State's employee assistance program, and they sent me basically to a bunch of quacks who have no idea what the heck they're doing. But they give you 5 free sessions. The people watching this podcast or listening to it probably don't know what Penn State's employee assistance program is. But if an employee is struggling with mental health, you get 5 free sessions, right? And so I called the Penn State Employee Assistance Program, and the only person who had an opening was some guy 45 minutes away over in Lewistown. Well, I've never been to Lewistown before. So I went over there the day after an ice storm, and I drove all the way to Lewistown. And he just wanted to talk about my diet, and he thought if I changed my diet, then my depression would go away, basically. And so the nice man, but he just had absolutely no idea what he was doing, and he in terms of treating mental illness and so forth. So it is hard. I think it's harder for somebody who is a professional psychologist to find good treatment because I can't help being critical. You know what I mean? I can't help kind of being, but I have seen people who are very good. I saw a woman in Akron, Ohio, when I was in graduate school who was very helpful and very good. But the thing, first of all, I think the mental health, you go into this a little bit in your book,
Hmm.
but the mental health system is a train wreck,
Hmm.
especially here in Center County. And I mean, I could go on and on about this, but it was very, very hard for me to find a good therapist, to the point in which I just kind of gave up. And now I'm just on meds. I'm just using meds and checking in with my primary care physician. So
Mm.
I talk to my primary care physician kind of, and that's
Okay.
what I do basically.
Interesting. So you prefer to work with the primary care physician rather than a psychiatrist?
At this point, just because I've had so much bad luck. I mean, the last 3 or 4
Yeah.
people I've seen, I saw this one dude, he did therapy in shorts and bare feet, and he
Oh
you
my
know,
gosh.
all he did was talk about himself the whole time and
Yeah.
his history of, it's just, I've just had so many bad experiences that I've kind of just given up. I know that sounds terrible, but I've just given up on finding a good therapist.
Yeah, it's relatable. I went through a phase for a few years where I really needed to be in with a therapist, not just a
Yeah,
psychiatrist, because as someone with bipolar type 1, I think
exactly.
personally, you
Yeah,
really need that combination of medication and
definitely.
therapy.
Yeah.
So I was getting really discouraged because, I was having depressive episodes and I did have a therapist, but I couldn't talk to her because it was like you were describing. She would only talk about herself. It wasn't a dialogue.
Yeah.
It felt as if I was talking at a wall and kind of just venting and complaining. And that's not beneficial. So let me
And you need to
ask
be
you
validated.
exactly. You want to be heard,
Yeah.
you want to
You want
be
to be listened
validated.
to. Hearing and
Mhm.
listening are different things. Listening is
True.
deeper than hearing. Definitely.
Absolutely. So, what would you say, I don't know, the top 1 to 3 most important qualities of a good therapist are?
Number one to me, being non-judgmental.
Yes,
Being
agreed.
non-judgmental. And number two would be being a good listener, which now being non-judgmental is part of that. And I think the non-judgmental is by far the biggest. And then just kind of just knowing what you're doing, knowing the nuts and bolts of therapy, knowing evidence-based treatments. Like for example, if you see somebody for obsessive compulsive disorder, do you know exposure and response prevention? Do you have training in that? So the
Mm,
biggest thing is being non-judgmental, and then just kind of having a knowledge base beyond that, just having a knowledge base of knowing what to do to effectively treat certain disorders, right? Because I think the relationship's the most important thing, relationship building,
mhm.
but knowing techniques and knowing interventions is important too. You can't just do all nothing but relationship stuff for many mental health issues. You know what I mean?
Yeah. In my personal opinion, I think that it's really important to have a good personality fit with your
Oh yeah,
therapist too.
yeah, definitely.
Like I've been working with the same therapist for about the last 4 years now, and she's just been fantastic because I can tell that that we click. We're into similar
Definitely.
things. We listen to the similar music, like
Yeah.
whatever. And it's just been like a night and day difference. And it's helped me so much, not just with bipolar disorder, but with my comorbid conditions. I also live with OCD and
Oh wow.
ADHD,
Mm.
so I agree with you. I think those are all awesome points. Now, let's transition a little bit to Penn State. Penn
Okay.
State is where I met you. Penn State is where I got my bachelor's degree. I spent 3.5 years there, actually. I graduated a little bit early.
Okay.
Um,
I did that at Ithaca College too, a semester early.
it's cool. Yeah, it gets you out a little bit quicker. But I wanted to ask you, like when I was a student at Penn State with burgeoning undiagnosed mental illness, I felt very alone. I felt like I was in an ocean and I
Yeah.
didn't know what resources were really available. I didn't realize how severe my symptoms were getting.
Yeah. Were you aware of CAPS?
CAPS, which Dr. Wimer just mentioned there, is Counseling and Psychological Services. It's a mental health resource center for Penn State students that is well intended and does good work, but can only do so much due to resource constraints. And we'll discuss that with Dr. Wimer in just a second. I was aware of CAPS, and as a matter of fact, I did go to CAPS, and you know what I found there
Mm.
was that they were having like graduate students doing the counseling sessions, and they also required them to be on video so that the
Yeah.
student could get like their credit hours or whatever.
Yeah. This is like training
Um,
stuff. I did that in Akron as well.
yeah, and it was very strange to me, and I tried to be as transparent as I could, but I was like, I don't know if this, and here's, maybe some paranoia happening too. I'm like, will word about this get back to the university? Will I get kicked out of school if I start talking about some of this illegal activity I'm involved with, some of this
Yeah,
dangerous
yeah,
behavior I'm involved with?
yeah, yeah.
So, anyhow, my question for you is right now, how effectively is Penn State's big school culture supporting mental health among students? Are there more resources now? Is it
I think um, I think they're definitely committed to making things as best as possible, but I think it's just a numbers game.
Mhm.
There's what, 55,000 students at Penn State, something like that. It's just a numbers game. And so I'll just talk a little bit about my experience. So I worked at the counseling center part-time, 1 day a week, maybe half a day a week for about 7 or 8 years. And I had a very wonderful experience there. They're really hard workers there. People are very committed. The problem is it's one floor of the health building, and there's tons, and there's just so much demand for services that they're just completely overwhelmed. And
Yeah.
when I was there was, I think, a 10 session limit. It's probably different now. I haven't been there in 3 or 4 years. Since
Yeah.
COVID, it's probably the demand for services is just through the roof. So I think it's just, once again, just a raw numbers game. I think people have good intentions,
Mhm.
and I think there are outreaches and stuff like that. I think students are aware. It's just there's just too many students, and there's just not enough therapists to go around. And I think in a perfect world, I think they should have a new building, an entire building for the counseling center rather than just
Yeah.
one floor of the health building. They just don't have enough raw office space.
Wow.
They just don't have enough physical office space. I think that's just a huge challenge. But yeah, and then in terms of the community in the area, everybody I know who is in private practice is completely full, completely booked, has a long waiting list. So it's just they're just flat out just aren't enough therapists in the area, you know. And
Yeah.
I mean, there's so many, but one barrier is insurance companies and getting people onto their panels or whatever, and so forth. And so, I mean, there's a lot of barriers to that, but there's just a huge demand for just more practitioners. And another thing is the stigma of seeking help is so much lower now than it was even in 2014 when you were at
Mm.
Penn State. So, I mean, the generation that's in college now is very much, I mean, interested in mental health and so forth, and very open to seeking help. So once again, that kind of adds to the demand for services. So again, it's a question of just good intentions, but just being completely overwhelmed by just an incredibly high demand for services.
I read something, I believe, from the NIMH that indicated 10 to 30% of adults aged like 18 to 25 encounter diagnosable forms of mental illness each year.
I'm not
So,
surprised. Yeah.
yeah, so like 10 to 30% of like 55,000, that's a
Yeah,
lot of people. Like,
it
I
is.
can't do the
Yeah.
mental math, but it's a
Yeah.
lot, right?
And COVID, I mean, increased the rate of anxiety in particular to a large extent.
Hmm.
There's far more. I mean, first, people are more aware of it, and also I think there's legitimately more anxiety in society now. There's just
I've
more people with anxiety disorders ever since COVID.
I've really felt that way too, especially over the last year and a half. I've noticed a lot of my friends and peers who also live with serious mental illness have been going through episodes, and it's interesting because it seems like, and this is totally subjective. I don't think there's research supporting this or anything, but I've just noticed within my friend groups, it seems as if people start having episodes around the same periods of time.
Hmm.
So just a correlation I've noticed,
Yeah, yeah,
probably because we're, watching similar things from similar
yeah,
socioeconomic backgrounds,
yeah.
whatever.
Definitely.
But I did want to go back for a moment and just ask, what would you say is the most important thing for college students to understand about maintaining strong mental health? Do you think that's something that, a 19-year-old Penn State student is thinking needs to be taken seriously?
Oh, it definitely needs to be taken seriously. Um, in my time working with college students, I've worked with college students as a clinician at Penn State, at the University of Akron, and at Grand Valley State University. So three different institutions. I've noticed lots of themes. Sleep hygiene is a big issue.
Yeah.
College students have, they're basically nocturnal, and then they get up for a 9 a.m. class. And so college students have pretty horrible sleep habits. That's a very common thing that I worked on with my clients. Time management and prioritization skills are things that I worked on quite a bit with my clients. You'd be amazed at the number of people who had difficulty simply just managing their schedule and what schoolwork to do, when to turn stuff in. So just the nuts and bolts of just managing a schedule and time management and prioritizing. I've worked with many students on that. And then another thing, I think, especially contemporary college students are just kind of in their head too much. They think too much, right? Many of my students, and we have class discussions about this all the time, including the other day in my classes. And students just, they're pretty open about how they just are in their head too much. I always ask my class, how many of you would like to be able to just shut your brain off for 5 minutes? And everybody raises their hand.
Uh-huh.
Right? So people are just in their head too much. And I think that's another issue too. So how to have, more, what's the word, more rational thinking habits and things like that. And one thing I teach my clients and students quite a bit is Albert Ellis's rational emotive behavior therapy, the ABCDE model. I don't know if you've ever heard of that, but A is the activating event, which would be some kind of trigger. In class, I use the example of getting a rejection letter from a job or a graduate school. So that rejection letter is neutral. How you respond to it with your mind is subjective, and we have control over that, right? You can respond to it in a rational, productive way or an irrational, self-defeating way. Right. And so I think it's important for college students who struggle with mental health to just think about thinking, think about how they think about things and stand back and look objectively, examine objectively about how they navigate their world cognitively, if that makes sense,
Mm-hmm.
And many times people are artificially unfair to themselves. They set unrealistic goals.
Mm-hmm.
That's another thing, is people have unrealistic expectations and unrealistic goals. So you don't want to have low goals, but you want to have high but realistic goals. I think that's another important thing for college students nowadays. For example, Hunter, I write tons and tons and tons of recommendation letters. I've talked to many. I've had many students over the years who are, told by their parents for years and years and years that they're the greatest human being alive or whatever. They're kind of spoiled. And they think they can get into Harvard and Yale with, a 2.2 GPA, right? You're not going to get into a PhD program at an Ivy League school with a 2.2 GPA. So
Yeah.
a big thing that I do is I just feel like I burst people's bubbles all the time, because so many college students have unrealistic expectations, so that's another thing.
Interesting. So when it comes to serious mental illness, there are, I don't want to generalize too much. So let me just speak to bipolar disorder. Bipolar
Sure.
disorder tends to manifest between ages like 18 to 22-ish?
It depends, really.
Depends.
Yeah.
So, okay, so let's say if regardless of age, like 12 years old, 65 years old, let's say someone's encountering a condition like bipolar disorder for the first time. What do you think
In themselves?
in themselves? Yes, in
Yeah.
themselves. What do you think are like the biggest red flags that one should watch out for, or that would be a key indicator that something is going seriously wrong?
Yep. So, Hunter, what I look for as a clinician is functioning drop off.
Mm,
So, like, for example, working with college students, if a student is normally an A, B student and now they're getting C's and D's, that's an indicator something could be going on. If somebody has never gotten in fights before, has never had legal problems before, and suddenly they're getting in fights, or if somebody's never had a problem with gambling. I had a bipolar client once who went and got racked up $10,000 in gambling debt in one weekend during a manic episode,
yeah.
So are people suddenly having money problems, whereas they didn't have money problems before? So I always look at life functioning. I know I've mentioned that as kind of a common thread of this conversation today, but if their functioning was here and now it's here, and there's areas in which it's dropping off, that's one thing. Something else, just behavior changes. Like with schizophrenia, the prodromal phase of schizophrenia involves the kind of the beginning stage before the active psychotic break. involves behavior changes. So if somebody starts acting strange, whereas they didn't act strange before. Now, the thing is, with really severe mental illness, people tend to lack self-awareness, right? So people are normally going to observe changes in loved ones, roommates, friends, something like that. So many times, like I've had many schizophrenic clients. The schizophrenic clients I've worried about the most are the ones who think that they're they're completely believe all their auditory hallucinations and things. They think that Satan is actually talking to them, and so forth. All right. So those are the people. So you're asking me a question about becoming aware. The worst cases are people who lack self-awareness, But another thing, I just mentioned auditory hallucinations. In really severe mental illness, that's a relatively common symptom. So if somebody starts having auditory hallucinations, that's another sign that you definitely need to get on some kind of medication or something. The good news is that auditory hallucinations is very treatable with medication.
Yeah, I mean, I take antipsychotic medication. For the audience, I have bipolar type 1 with psychotic features. And when you're having a manic or depressive episode with psychosis, it is kind of similar to what someone with like an active episode of schizophrenia may be experiencing. And those auditory hallucinations are fucking scary, dude.
Oh yeah.
Oh my God. Like I've had
Well,
situations.
there's actually a range of them. They can be actually comforting in some cases, but
Yeah,
in the really
yeah.
worst cases, they are scary. Yeah.
Sometimes it's like, you're the best. Other times it's like, kill yourself. And you're like,
Yeah,
what?
I've had clients who hear voices telling them to kill people and all sorts of things,
And it doesn't necessarily mean that someone would act on those. It
Exactly.
can be
Yeah.
extremely distressing to the person who's having that type of hallucination because they have that dissonance between, this is not who I am. Doesn't feel like it's a real part of me.
Oh, yeah.
And that's distressing as well.
Of course. Yeah. And it's distracting too. I mean,
Distracting and distressing. Yeah. What would you say the most prevalent myth or misunderstanding about people with serious mental illness would be? What's something that really needs to be dispelled right now when it comes to discourse around individuals with mental health conditions?
Yeah, that's an interesting question. I thought about this before. It's a couple things. One is the myth. We talked about this a little bit before. The myth that people with serious mental illness are very dangerous. Right? They can be dangerous. I've had maybe a handful of clients over the years who I was kind of worried about. But a large majority of the time, they're not dangerous.
Yeah.
I've worked with in community mental health when I was getting licensed. I work with tons of people with schizophrenia. And, I never once felt unsafe in a session with someone with schizophrenia, right? But so the media wants you to kind of transmits this cultural narrative that people with schizophrenia and bipolar are very dangerous people. When, that can be the case in very rare instances, but so can, a person without a mental illness just on the street, anybody can be dangerous. And so that's a big myth. Also, I just can't stand Hollywood and Hollywood's portrayal of mental illness, right?
Sure.
Just whenever a student comes up and asks me about like a movie or something like that, it really kind of like, I don't watch movies about mental illness because they usually piss me off, right? They usually piss me off. And then the condition that it's so misunderstood is DID. DID. First of all, whenever I'm watching a movie or reading a book and a character has DID, I just roll.
Sorry, just dissociative identity disorder.
Dissociative identity disorder.
A lot of people may know that as multiple personality disorder.
Yeah, that's what it used to be called. Yeah.
I'm sorry. I just wanted to clarify for people.
Yeah, that's fine. So yeah, it's having that portrayed in Hollywood is just such a cliche, and in real life, actual legitimate cases of DID are extremely rare.
Yeah,
extremely rare. But so there's lots of myths and misconceptions about that, which I can consider a serious mental health illness problem.
Okay. Here's a question that came to mind. What movie do people reference the most when they come to you after class and are like, have you seen this? Or is this real?
Probably Split.
Split?
Yeah. And
okay.
To be completely honest, I fucking hate that movie.
Yeah.
I saw it, but it's just that movie has taken our knowledge of DID back probably about 20 years. But anyway, that's probably the one people talk about and ask me about the most.
Yeah, I totally agree with you that media and entertainment just completely misses the mark when it comes to serious mental illness a lot.
Definitely, yeah.
People with bipolar disorder, including myself, seem to resonate a bit with Silver Linings Playbook. There's a
Yeah, yeah.
couple of choice scenes. Overall, it's not like a totally accurate depiction of bipolar disorder, but there's
Yeah,
a couple
yeah.
of choice scenes that really do speak to me and seem to speak to others, but that's
Definitely.
a rare case.
It is
And
rare, and it's also a good movie that's well acted and well written. That helps
true,
too.
true, very true. Bradley Cooper kills it in that
Yeah,
movie.
yeah,
And so does Jennifer Lawrence. Let's give everyone credit.
yeah, yeah.
Here's another question that I had for you. And this question might be a little bit wide spanning, but it's something very important that I really wanted to talk to you about. Now, as you know, you've read my book. Thank you so much for taking the time to
Oh, you're
do that.
welcome. Yeah, yeah. It was
Uh,
great.
yeah, man. Well, thank you again. And as you know, I have been forced into inpatient hospitalization, and it was really intense. And, even looking back, well, let's see, what year is it? I don't know, whatever, 7 to 10 years later, I really, really wonder for people like myself who have had really negative inpatient hospitalization or crisis intervention experiences, it can cause distrust within the community in
Definitely,
terms of
definitely.
like,
I mean, I'm a psychologist, and I kind of distrust the system because I've had bad experiences.
yeah,
Yeah,
it
yeah.
creates like animosity against hospitals, against healthcare providers, against
Health insurance
police,
companies are the
against health
biggest
insurance
people.
companies.
Yeah.
Yeah. So, what are some ways that you think communities or local government entities could reestablish, or I guess for the first time, establish trust with people who live with mental illness?
Not treating them as just a way to, increase profits for the CEO, and so forth,
Hmm.
treating people as human beings instead of commodities. A
Right.
term I recently worked in community mental health before up until the pandemic, and then I stopped. And the people refer to our clients or patients as consumers. I hate that term.
That's fucked up.
Consumers. Yeah,
Yeah.
and so just I don't like thinking about people that way. Um, but anyways, I think having less turnover at institutions, psychiatric hospitals have lots of turnover, right? They're poorly trained, poorly paid, paying people actually well, putting more money into mental illness, you know. So like for example, I have a former student who actually I think I'm going to recommend you talk to her about and maybe even have a guest on this podcast because she worked at the Meadows for a really long time. But
What is the Meadows? Is that a
although the Meadows is a local psychiatric hospital, it's
oh,
around
okay.
here. It's near Penn State. It's a psychiatric hospital
Got it.
near Penn State, and it's I mean it's recently it was featured on Vice News and there's been scandals there and stuff and so
Hmm.
forth. But anyway, she said she would make more money at Sheets than as a mental health tech.
Hmm.
Right. So just paying people more, you attract more skilled people into the profession. That's one thing.
In this next part of the conversation, Dr. Wimer mentions something that I had never heard of before. It's called the Milan Clinical Multi-Axial Inventory, and it's a type of personality assessment that's administered to evaluate individuals' personality traits and propensity for psychopathology. It was originally developed in the late 1960s, but has since then undergone a number of updates, the most recent one being in 2015.
And then I think in terms of law enforcement, eliminate law enforcement officers who have narcissistic or antisocial personality disorder. I think that's a big thing. I think if in terms of selection of police officers, I would like to see them give police officers the Milan Clinical Multi-Axial Inventory.
Okay.
And if anybody has an elevated score on narcissism or antisocial being criminal behavior, not shy, right? People misunderstand and misuse the term antisocial. But anyway, if they score high on narcissistic or antisocial, they should be denied. They should not be allowed to be a police officer, because both of those involve a lack of empathy, right?
Right.
So just more empathy, just having more empathy, right? I think that's one of the reasons why I've been a successful therapist and why clients like me, and they keep coming back. If they have a relapse, they contact me again and say, they want to see me again. It's because I think I validate them, and I validate them, and it's not about the money, and all those things. And so also streamlining the insurance process, the paperwork. I mean, paperwork is just absurd. All right. The last time I worked in community mental health, the paperwork was like something from a Monty Python routine. If people get that, I don't know if people know what Monty Python is, but or a Saturday Night Live routine. I guess people would get that reference. But it's just reducing. Here's an example. The last time I was in community mental health, I was required to have an iPad with me at all times. And I was required to do all of my paperwork on the iPad during the session with the client. So the company valued the iPad and the paperwork more than the client, right?
Yeah.
So I don't believe in doing paperwork right there with the client right in front of you. I don't think it doesn't establish trust.
Yeah.
Right? And I'm not making eye contact with them. I'm constantly looking at the iPad, and eye contact is very important.
Yeah.
Right. So I just think we just need to completely rethink the entire system and make it about empathy and treatment and effective treatments for the right situation, the right person, rather than just about money. Right. The entire American healthcare system is broken because it's all about profit. It's about the CEO having a bigger yacht. So most of them are old white men, right? Having a bigger yacht so he can have bragging rights at his country club. All right. That shouldn't be what it's about. All right. It should be about, we know there's tons and tons and tons of evidence. Most mental illnesses are very, very treatable, very, very treatable. And we have the tools. It's just a question of implementing those tools, implementing those interventions in effective ways, right? In effective ways that will not make people defensive and so forth.
Yeah.
So I kind of went off on a tangent there, but
No,
I guess that's what this podcast is for.
Yeah, absolutely. It's absolutely for that. And I was nodding my head so vigorously as you were speaking. My headphones almost came off. I don't know if you noticed.
Yeah.
So let's talk about people who do have empathy and do want to help individuals around them who may be having some struggles, some trials and tribulations.
Yeah.
What can the average person do, the average neurotypical person do to help a friend or family member who may be experiencing a mental health crisis or who is possibly at risk of experiencing a mental health crisis?
Well, again, validate the person. Don't freak out. Don't be judgmental. Be non-judgmental. I've had so many clients whose parents are judgmental about medication, about all sorts of other things. Just not be judgmental. Develop awareness. Find legitimate information. And that's one thing. A general big picture problem in the entire world right now is just finding legitimate information instead of crap information.
Yeah.
Right? There's just so much crap information out there. So having legitimate evidence-based information, and also just knowing about the resources, hotline numbers, like here in Center County, there's the Center County CAN helpline, all sorts of things, just knowing the various resources and so forth. And another thing, if somebody is suicidal, don't let them have access to firearms.
Yeah.
Access to firearms is a big issue. All right. And, if somebody to be completely honest, I struggle with depression. I am on Prozac. I go through suicidal times. That's why I don't own a firearm.
Sure.
I have family members who are into hunting and they want me to go hunting with them. They're like, Dave, do you want to buy a shotgun? I'm like, fuck no. If I owned a shotgun, I would probably be dead because I go through such serious depression. You know what I mean?
Yeah.
So at times. And so just avoiding firearms, keeping people away from firearms, keeping them locked or out of the house and so on. That's another thing.
Yeah, and I think that's such an important point, and I think I would just mention from my lived experience and stuff, that concept can also apply to, like, narcotic medication,
Oh
like
yeah, yep, yep,
Klonopin, like, if you,
yep.
you know,
Oh, like overdosing and so forth.
yeah, like intentional overdoses on
Oh yeah,
Klonopin or even, like
oxycontin. Yeah,
Oxy or even
yeah.
stuff. Can you overdose on Prozac? People try to
I
kill
don't, I don't,
themselves with.
I don't know. I've never heard about it.
Okay,
But
well, let's not find
I
out.
once had a crisis call. Somebody took 30 Tylenols, but she got her stomach pumped and survived. But yeah,
Hmm.
yeah,
Okay. Well, I'll make a note of that and do some more research later.
yeah.
So I did go ahead and look this up after the interview with Dr. Wimer, and as it turns out, you absolutely can overdose on Prozac. So, like pretty much any psychiatric medication, Prozac needs to be used carefully. If you are feeling as if you may want to abuse Prozac in order to harm yourself, please, please, please reach out to your doctor and talk to them about adjusting your medications or changing your treatment plan. What are some of the best resources for people who are looking for that legit info so they can inform themselves?
Experts, people who have doctorates,
People
and
such as yourself, yes.
yeah, yeah. Except, I mean, Dr. Phil is an expert, but he's an entertainer. You have to realize some people are entertainers. Dr. Phil is an entertainer. He is not
Mhm.
out to help people. He's out to entertain people, right? So, the American Psychological Association, that's a good resource. APA's website, APA, I believe it's apa.org. The American Counseling Association's website. Um, the I think it's the NASW, National Association of Social Workers. So professional organizations. Monitor on Psychology, APA's magazine, the Monitor on Psychology, very, very good resource, and you can get that for free online. All right, you can
Yeah.
get a PDF of it for free online. So those are, anything that's evidence based. It's
Mhm.
evidence based rather than anecdote based.
Mhm.
And it's created and written by people who know what they're talking about, and not just somebody making a TikTok video. You know what I mean?
Sure.
If you want legitimate information, stay the hell off social media.
Mhm.
Do not go to social media for legitimate information. I am immediately skeptical of anything that's on TikTok or YouTube. I'm
Mhm.
like immediately skeptical if anything is on TikTok or YouTube. So
Well, let's shift gears just a little bit. I wanted to talk to you a little bit about your creative endeavors. In
sure.
addition to psychology, you
Yeah, yeah.
have a strong interest in science fiction and fantasy
Right.
universes. And I was kind of curious. So, when you're writing a book or a short story or whatever, do you think that your background in psychology influences the type of characters you create? Has it informed your narrative style or anything?
Yes, it definitely does, Hunter. So my first novel is called Seatopia. It's out of print now because one thing I'll say is that I love to write, but I hate dealing with the publishing industry.
Yeah.
The publishing industry is horrible, and partially because nobody buys books anymore, and so
Yeah.
my publishing company, unfortunately, Double Dragon Publishing, they were called. They went out of business, and so
Mm.
my books are now out of print, unfortunately. But I own the rights again. I got the rights back, so I could submit them somewhere else. My novels.
Okay.
But anyway, so my first novel, the idea for it came to me from a series of nightmares that I had while I was in the army.
Okay.
So when I was in the army, I had a severe shoulder injury. It's why I was medically discharged. So I was
Mhm.
honorably discharged for medical reasons. I tore my left biceps tendon when I was in the
Ouch.
army. It actually wasn't that. It felt like a noodle going up my arm. It actually wasn't that painful, but
Really? Okay.
some aspects of it were painful, but like the rehab and stuff.
Yeah.
But anyway, but I had this recurring nightmare that I was being eaten alive by a shark. And that nightmare, I turned it into this novel, right? But my main character in the book, his name is Jonathan Breyer. He has bipolar 2. He has hypomanic episodes, right? So I use my knowledge of treating people with bipolar 2 to kind of incorporate that character. Another character, Dr. Brendan Kim's in the second book, he has PTSD because he almost dies in the first book. And so another character uses a hologram to do basically prolonged exposure therapy, which is what you use for people with PTSD. So they use holograms to recreate the traumatic experience. So I definitely incorporate my mental health, background, my psychological background, also just my personal background, because basically I write fiction as a way to cope with my own depression, and that's one of the reasons why I still love to write. I write stuff all the time. If you're an artist, you can never stop creating, right?
Agreed.
But I stopped publishing stuff because dealing with the publishing industry, actually, so the reason why I write is to cope with my depression. Dealing with the publishing industry was making me depressed. You know what I mean?
Yeah.
So, so that's why I kind of stopped publishing, but I have tons of unpublished stuff. But another thing, I had a horror story, a ghost story that I wrote called Leg Bone. It got accepted by a horror magazine, and then before it got published, the magazine went out of business. So I have this curse where like stuff is always published, and then the entity that publishes it goes out of business, right?
Yeah.
So I've kind of been snake bitten with that. But the long answer to a short question. But to sum up, yes, very much so, very much so.
Very interesting. Have you ever thought about self-publishing?
I have. It's a lot of work. An advantage of the publishing company that I had is they had an in-house artist. I think the cover art was great. You can actually look up the cover art for my books. You've probably seen it online. You can look it up on Google Image or something. But I would have to pay for cover art if I self-published this. And since hardly anybody buys books anymore, like my grand total of royalties I made from my novel, I spent a year working on my novel, and I made maybe $150 in royalties from it. So it's like a year of work for $150. I don't like to think about things in terms of monetarily, because I write because I like it. But still, it's just not a worthwhile investment. And I'm so incredibly busy and all those things. But it is, where I use my creativity is as a teacher, coming up with class activities. But I think it's very important for people to utilize their creativity, and I think it's wonderful that I have a career that allows me to be creative,
Yeah. This kind of just called to mind something interesting to me. I was having a conversation with a friend recently, and she had gone through some really, really intense traumatic events. And her self-care strategies that she primarily puts in place are things that distract her, like things like knitting or cooking or something like that.
Yep.
But
Distraction techniques.
yes, exactly, distraction techniques. And I was wondering, so we were talking and she was saying to me, I'm doing all this stuff. It's helped to an extent, but I still have all of this intense trauma that I'm trying to work through. And my response was, have you tried like a creative outlet where you're doing a little bit more engaging? And I'm no therapist. I wasn't trying to, but it just came to mind for me. Like, do you ever work on creativity or creative projects to process and actively work through those? Do you think that could be a good strategy for some people, or did I just re-traumatize my friend?
No, not at all. But I think it can certainly help, but it's not a panacea. It's not a cure-all. I mean, basically, from my own I've been diagnosed with PTSD from the stuff that happened to me as a kid. My parents used to attack each other with knives and things like that. I mean, I had a lot of really crazy stuff happen when I was, sorry to use that word, but a lot of problematic stuff happened to me when I was a kid. But anyway, so I know from my own experience, you can't outrun trauma. You have to face trauma. And that's the reason why I went to see that therapist who just talked about my diet, was to talk about my childhood trauma. But he just wasn't. Whenever I tried to talk about my childhood trauma in session, he would change the subject to something superficial. You know what I mean? But anyway, but the thing, because I know enough about the field to know that my PTSD will never go away unless it's treated, unless it's overtly treated. And the way to treat it is to have you, either through imagery or through virtual reality or something, is to re-experience it and just reduce your fear response.
Oh,
Right?
man.
Reduce the fear response. So you need to have a professional help you with it. And so for me, it's like as I get older and I can kind of cope with things better and stuff like that, but still, it's always there, still there, and
Yeah.
it'll never fully go away unless I overtly do something about it, have a professional help, unless I get professional help for it. You know what I mean?
Why do you think exposure therapy, re-exposing, for people who don't know, basically, let's say you're really paranoid about leaving your house. So the first step would be leave your house and then
Yeah.
sit with that and
That's like in
absorb it.
vivo exposure. Yeah.
Why is that helpful for people? I've done it and it's helped me, and
Yeah.
I don't know why. Like,
Um, yeah, I mean, I'll try to formulate a good response to this. It's basically just reduces the fear response. It's kind of like getting into a swimming pool a little bit at a time. You know what I mean? And
mhm.
eventually you get used to the cold water. And so, yeah, it's just like, for example, I'm used to be a military psychologist, so I know a lot about PTSD with combat veterans. So there's a lab at USC, Dr. Skip Rizzo. You can if you've never seen some of his clips online, I'd recommend looking at them. Dr. Skip Rizzo is his name. He runs a lab at USC that does virtual reality treatment for veterans with combat-based PTSD.
Yeah.
And just being back in that combat, it's if nor if you're traumatized, you have negative associations with that in your mind, and it just kind of reduces those negative associations. So it's basically just behaviorism and conditioning. It's just
Yeah.
kind of raw, just conditioning and deconditioning, or extinguishing the fear response.
Yeah, like Pavlov's dog, kind of
Stuff like that. Yeah,
at its
exactly.
most basic level,
Yeah,
right?
yeah, yep,
Yeah.
definitely.
Cool. Well, thanks for explaining that. Makes
Yeah,
sense.
with mental health treatment, stuff should ideally be based in some kind of theory.
Mhm.
You should have some kind of theory, some rationale, something systematic to guide what you're doing, basically.
And when Dr. Wimer says theory, he means a scientific theory, not
Yeah, well,
something
exactly.
not just
Exactly.
something
Yeah,
that
like
someone came up with.
object relations or something. The best
Yeah.
therapist I've ever had was a guy named Barry, who I had in graduate school, and he was an object relations therapist. So that really worked for me. But it's
Wow.
basically contemporary psychodynamic.
Okay. Very interesting. I actually am not familiar with that at all. I don't think I've heard of that. Do you want to expand a little bit, or is it
Sure. Yeah.
okay?
There's many object relations theorists. My favorite one personally is Heinz Kohut, and it's basically about perceiving yourself and others accurately is the goal. So
Mm,
let's say, I've seen many clients who they get into a romantic relationship with somebody, and instead of seeing the true person, they see what they want to see in the person. So object relations therapy is about becoming aware of that, because psychodynamics is always about raising awareness and just being able to perceive yourself and others accurately rather than in a distorted way. I mean, that's a
mm.
gross oversimplification, but that's the basic premise behind object relations.
Gotcha.
Yeah,
Interesting. Thank you for sharing that, because
right.
I'm not familiar with it. No one's brought it up on this show so far, and I always love when we hear about new theories or perspectives or whatever. So thanks a lot for that.
Definitely.
I know you said that Prozac has been very instrumental for your treatment and your well-being. Do you have any other self-care strategies besides writing that you use to kind of help work through things or remain at baseline?
Definitely. Minimizing screen time. I know it's kind of ironic because I'm looking at a screen right now,
Yeah.
I've just noticed the more time I spend, especially on friggin' email, right? The more
Hmm.
time I spend on my computer, the worse I feel. The more
Hmm.
time I spend, like I own a house. I one of the best decisions I ever made in my life was I used to live in an apartment, and I bought a house 3 years ago, and it's so much
Nice.
better. My
Nice.
experience is just so much better, and I enjoy doing yard work. I enjoy mowing the grass, just getting out and being in nature. So
Hmm.
I love hiking. I love camping. I actually just went camping last weekend.
Yeah.
So I love hiking and camping. I've camped in all kinds of weather, cold, hot, anything. So I love to read actual books on actual paper. I love to read books, comic books, and graphic novels.
Yeah.
Especially, I'm a huge fan of Moebius. I don't know if you've ever heard of Moebius. He's a French science fiction. His real name is Jean Giraud, a French science fiction graphic novel writer. But
Okay.
I love reading Moebius's stuff, and Hodorowski as well. Anything that Hodorowski and Moebius did. But let's see, anything else? Those are the big one. Music too. I love going to see live music. That to me was one of the the hardest things about COVID was not being able to see live music.
Oh my God,
Like,
tell me about it.
yeah, I
Yeah.
saw a lot of concerts like on Zoom or whatever, but it's just not the same. It's just not the same for being there in
Yeah.
person, you know?
Well, that segues very nicely into something that I also wanted to talk about, which is how you and I met, and a little bit about how this electricity got started, you know?
Mm.
So, when I guess I was 21 years old at the time, I enrolled in one of Dr. Weimer's Psych 470 courses.
Mhm.
And during one of your lectures early on in the semester, you kind of offhandedly mentioned the band Opeth.
Oh,
And
yeah, yeah. Yeah.
that sparked my curiosity. I was intrigued. I was like, okay, who is this guy? I need to go talk to him about heavy metal now.
Yeah.
Um, so when I was in your class, it was a really trippy experience. I was undiagnosed at the time, and I just very vividly remember you were doing a lecture about bipolar disorder and the different types. And I write about this in my book. I call him Dr. Bachman in the
Yeah,
book.
yeah. Bachman Turner Overdrive.
Yeah, right. Um, so
Yeah, I love that part of the book.
yeah, man. I had to give you a shout out in that
Yeah.
book because it was like I was sitting in one of your classes one day and you were like, oh, like reduced need for sleep, overspending, drug abuse, et cetera, et cetera. And you were just going down this list, and I was like, oh shit, that's everything going on in
Yeah,
my
yeah.
life right now.
It's even more
And
than that. Teachers call that the medical student syndrome when somebody does, but in your case, it's legitimate, you know,
yeah, no,
and you met all the criteria.
I
Yeah.
met all the criteria, and the crazy thing is I ignored it. I was like, these are all major red flags. I should be paying attention to this. But after that class, I was kind of just like, fuck, now what? So I just went out and kept partying, and what I now realize in about October or November of that year, I started entering hypomania.
Mm.
And after that point, a couple of months later, it had graduated into full-blown mania and
Wow. Okay.
psychosis. And
This was like January of 2015.
exactly,
Yeah. Yeah.
yeah. So anyhow, one thing that I really remember about that class and that I think was really cool is that we got to do a presentation
Yep.
about Sid Barrett. Well, it was a really cool project that we got to work on, and I kind of found out that you also have an appreciation for Pink Floyd. So this has been a very long-winded build up to my question. What is your favorite Pink Floyd album right now?
Oh boy. I actually love, I mean, I like everything except for the final cut. I'm not a big fan of the final cut, but I like pretty much everything up until that point. I would say maybe Wish You Were Here because I love Shine on You Crazy Diamond.
Yeah,
But I love my favorite era of Pink Floyd is actually their early stuff.
yeah,
I really like Atom Heart Mother. I like A Saucer Full of Secrets. But what I listen to most is live bootlegs.
yeah.
I mostly listen to live bootlegs from the late 60s, early 70s. Any live Pink Floyd bootleg from like 68, 69, 70. There's one, I actually have it on vinyl. It's called Tonight Let's Make Love in London. There's
Okay.
only two tracks. There's Nick's Boogie, and there's like a 16-minute version of Interstellar Overdrive. I really love that. I can even
Yeah,
get the record if I can find it and bring it in and show it to you. But so I have lots of Pink Floyd on vinyl. I like to listen to vinyl. But
nice.
so basically, any Pink Floyd live, they actually just came out with a new CD that was they just discovered the tapes. It's called Interstellar Fillmore. It's from San Francisco, like 1970. I just got that recently, so I recommend that. But I love any live album from the late 60s, early 70s from Pink Floyd.
That's awesome, man. I love that. And as a matter of fact, as I asked that question, I just remembered you had gifted me a
That's
couple
right. I
of
gave
Pink
you some
Floyd
Pink Floyd
bootlegs.
bootlegs.
Yeah,
The ones I gave you are my favorite ones.
they're dope. During my manic episode throughout the driving, so basically I went off on this literally psychotic road trip, and I was listening to those bootlegs that you had given me at certain points during the trip, and I was like, this is getting psychedelic, and
Oh yeah.
that's a problem.
I love
Mhm.
the song Embryo because it's about being in the womb, you know, and it's like I think that's really trippy. That song's really trippy.
Yeah, I've been getting super down with animals
Oh, I
lately.
like that album a lot. Yeah.
Yeah, yeah, man. That has really been doing it
Yeah,
for me
especially
lately.
dogs. I love the first. I love the whole album, but
Really
I like.
interesting. That's interesting that you like dogs because I actually don't care too much for that
Oh,
track.
really? Interesting. Okay. I
Yeah,
saw Roger Waters perform it live, so maybe that's one reason.
yeah,
And
that's
also,
cool.
one time I was listening to that song with my brother, and his dog started flipping out with at the dog barking in the
Yeah.
song. It was kind of interesting, but yeah.
Yeah. I mean, the production on that album is just incredible too. I mean, these are albums that you really have to listen to from like beginning until the
Yep.
end.
With
Like,
high quality headphones too.
yeah,
Yep.
yeah, it gets super trippy with it. Well, Dr. Weimer, this has been an absolute pleasure. We're right around 1 hour, and
Okay.
I know you said you've got about an hour.
No, that's fine. I mean, hey, the Eagles aren't on for another hour. So the Eagles are on Thursday night football right now as we're recording
Right
this.
on. Well, I just wanted to ask, do you have any final thoughts that you'd like to share? Is there anything that you're working on that you'd like to plug? Any way people can find any of the research that you've conducted?
Okay. Well, I mostly conduct research on the psychology of men and masculinities, Division 51 of APA. Um, the most recent stuff I've published is in the Journal of Constructivist Psychology. But I have um, the most recent one I wrote was a review. So in graduate school, my advisor was a guy named Dr. Ron Levant, Levant. He's one of the world's leading experts on the research on masculinity. And he recently wrote a book called The Tough Standard. And I did a review of The Tough Standard, and it serves as kind of an intro to research on men and masculinity. So that's the most recent thing that I've published. And that came out last year in the Journal of Constructivist Psychology. Before that, I wrote an article on Philip K. Dick, the science fiction writer.
Yeah.
And that was about his mental illness issues and so forth, and his amphetamine addiction and so
Mhm.
on. And so that was also in the Journal of Constructivist Psychology. But to be honest, I've been just so friggin' busy over the last few years. I mean, I write a zillion recommendation letters. I spent an inordinate amount of time updating my online courses, like content of like whenever the new edition of the textbook comes out. That's my big project now. So, and my main goal now is just to get back to normal after COVID. Just kind of get back to baseline after COVID. So I don't really have a lot of stuff. I'm writing tons of creative stuff, but I'm not publishing any of it. But
Yeah.
maybe in the future. But yeah, but if you ever want, this was really a cool experience. If you ever want to have me on again, I'd be happy to.
I would be thrilled to have
So,
you back on.
yeah.
And I know I was mentioning when we first started, but I really do appreciate you taking the time to lend your expertise to this show. We have not had a full-fledged psychologist on the show just yet. So
Okay.
you're
Cool.
like the first professional, subject matter expert who's been on to discuss these topics. And it's really helpful because although the pure perspective and these more general conversations that we have are really enlightening and cool, it's interesting to hear from the academic side of things, the hard science side of things.
Yeah, definitely.
So
Yeah.
thank you so much for coming on. I
Okay,
I
you're
really
welcome.
appreciate it, and you're welcome back anytime.
Okay, good. I'll end with this. The last thing of something I tell my clients a lot and students as well. It's important to focus on factors that you can control and to not worry about stuff you cannot control. I think it's one of my life rules. So I just want to end with that, if that makes sense.
Absolutely makes sense, and thank you for that. It was such an honor to hear from Dr. Weimer on the show, and I do certainly hope we're able to get him back on again in the future. I can't tell you just how cool of an experience this was to not just be able to speak to someone who is an expert in the field of psychology, but a person who I have a personal connection with. I took his course, and during those lectures, I started realizing, something is starting to go very wrong in my life. Of course, his lessons didn't start sinking in until it was too late. But I recovered, I bounced back, I'm here now. As Bipolar Recorder continues to evolve, we will continue hearing perspectives from peers as well as professionals. If you're curious about some of the topics that Dr. Wimer mentioned, I've included links in the episode description so you can take a look. Remember that Bipolar Recorder can be found on Twitter at Bipolar Recorder. My book that Dr. Wimer mentioned a couple of times during the show is called My Brain is Trying to Kill Me and is available on Amazon in Kindle and paperback formats. Check it out if you'd like. Proceeds from my book sales help keep the show running. Also, be sure to support the show by telling your friends about it. Let's keep getting the word out about mental health and the outrageous, amazing, sometimes scary things that our brains are capable of. My name is Hunter Keegan. Thank you for listening, and have a great and safe day, evening, or night, wherever you are. Bipolar Recorder is a listener-supported show. To help keep the show running, consider checking out our Patreon page or visiting bipolarrecorder.com.
Unless otherwise stated, the hosts and guests on Bipolar Recorder are not licensed mental health professionals. Bipolar Recorder is not a substitute for therapy or professional medical intervention. If you are having a mental health crisis, please contact your local emergency services.